The South African Sentenced and Awaiting Trial Prisoners Organization, SASAPO, says it is still awaiting the release of more than 600 prisoners who are eligible for parole, who are chronically ill and over the age of 60. The organization claims that the inmates are at high risk due to COVID-19. To discuss this further, we have now on the line SASAPO's chairperson, Phindile Zweni. Phindile, good afternoon to you. Thank you so much for joining us here on the SABC News channel.
Good afternoon, and thank you for having me.
Thank you so much indeed. Now, your organization has recently expressed a concern over the rise and the handling of COVID-19 cases in prisons around the country. Talk to us about that.
Well, numerous emails were sent to the office of the minister since the start of this COVID-19 pandemic. Up to date, we have received no response at all. Now, we're sitting here with at least, if I can say, we're sitting with 4 categories that the minister himself stated on national TV that's going to be released and having priority. Now, we're talking about people who were sentenced to life imprisonment. There's 3 judgments that were issued by the Constitutional Court about five years ago, which stated that lifers who has completed 12 and a half years, 13 years upwards, should be released provided that they have completed the required programs, including the victim offender dialogue, which is called the VOD, should be released and back to society. Now, at this point of time, we're sitting with 4,000 plus lifers, people who are sentenced to life imprisonment. 50% of those are already eligible for parole. Now, as we speak, at the minister's office, now the procedure there briefly is that from the center, the file of the inmate will be completed at the center, goes to the area commissioner, regional commissioner, national commissioner, and to the NCCS, which is the National Council of Correctional Services. Then they would then recommend that file to the minister. Now, currently, the minister is apparently sitting with more than 300-400 files of life. He should just sign because the National Council of Correctional Services already went through all the documents, which is right, and they have signed it off for the minister to sign. But that is not happening. The minister himself stated also that people over 60 years and those who are chronically ill, who have completed half of their sentences, will receive priority and be released. That has not materialized as well. He also stated that mothers with babies in prison, after completing half of their sentences, they would be considered for parole. Even that has not materialized. Now, we want to know from the minister. We have been, as an organization, have been sending numerous emails to his office, to his PA, Daniel and Rob. Not a single email has been responded back to me.
Mm-hmm. Because I wanted to ask, so if the minister had announced all these pointers that you're making publicly, why do you think there's that hold up? Why has it not happened? So you're saying that you've tried to engage the minister, but you have not been successful.
Can you come again with this last sentence?
I'm saying that you say that your organization tried to engage with the minister, but you have not been successful.
Yes, that's correct. We've been trying to get, even yesterday, I called his PA, and they wanted to ask me whether I've got in fact, they asked me whether I've got an MOU with the Department of Correctional Services. Now the question is, why now? I've sent an MOU 2 years ago to them for signature. And I met with the National Commission about 3 weeks ago. I met with him at his residential offices there in Khosi-Mampuru. But nothing is happening. Now, we are sent from pillar to post. Nothing is happening so far. We just want to know why is the minister not signing off so that we can alleviate the overcrowding in prison. That is all that we need to know. The people are dying every day. 2 or 3 people a day are dying in prison. And he knows about that.
But do you have the overall number of the inmates that are eligible for parole? Is it still 19,000? And do we know so far how many have been released, those that were eligible for parole due to COVID-19?
I can tell you now that if 1,000 of that 19,000 has been released, it would be a miracle. Because even the CMC, the parole boards within the correctional centers are having challenges because the people don't come to work for fear of the COVID-19.
So you don't
pandemic.
have the exact number now of how many have been released since the minister's announcement. Do you have the exact number?
I do know that there's not even 1,000 release of the 19,000.
Because some reports say 4,000, some reports say over 4,000 have been released. So very quickly, the question is, what happens now going forward, since when you cannot engage with the minister directly?
We want, if the minister doesn't come back to us and comes back to the nation and tell us what is going to happen about these people that should be released, that he promised to be released, we're taking him back to court. That's all. We've exhausted all avenues. We now have got to take him back to court so that he can be forced to release the people that are eligible for parole. We're not saying that we must release everybody. We're saying those who are eligible for parole must be released. The people are dying.
All right, time constraints. We have to leave it at that. Thank you so much to Phindile Zweni, is the chairperson of SASAPO. SASAPO is a South African sentenced and awaiting trial prisoners organization raising their concerns about a number of inmates who are eligible for parole, as he says, according to the Minister of Correctional Services.